Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health? Just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to personally welcome you to episode 37 of the Ask Dr. Angela podcast. I'm sure that everyone is hustling and bustling in this beautiful fall weather. I have got so much stuff going on. I just recently finished an interview with Parent Magazine, and that's going to be featured in an upcoming issue. When that goes to print, I will be sure to let you guys know. I am just continually blown away by the outreach of my blog posts, the podcast, etc. So I'm really excited by all the positive feedback that I have gotten, and I certainly appreciate it. So let's jump right into today's topic, which is going to be about HPV and what you need to know about HPV. So I'm sitting on labor and delivery, just kind of chit-chatting, and a couple of the nurses said, "Can we ask Dr. Angela a question?" And I said, "Well, sure, go for it." And so, basically the question was, what do I need to know about HPV? When do I get tested for HPV? What's the deal with HPV? And so I said, all right, this is the deal. Here we go. First of all, HPV is probably, if not the most, it's got to be like in the top two most common STIs out there. STI stands for sexually transmitted infection. At some point, roughly about 80% of folks have been exposed to HPV at one point or another. Most men, are clueless. Please don't take offense to that. I only mean that you guys really never go to the doctor's office, unless your girlfriends or wives or whatever prod and beg you to go, or unless you're going to get your prostate examined or something like that. Women, however, go see the OBGYN all the time. There's for birth control or annual exam, etc. And so we hear a lot more about HPV because a lot of times it shows up on our pap smear, specifically by causing some kind of an abnormality. Let me first of all start by saying that anyone that is under 30 is not routinely screened for HPV. HPV typing or co-testing typically does not begin until the age of 30. In folks that are younger than that are getting pap smears, HPV testing typically is only run when there is an abnormality that actually appears on the pap smear, whether that's something like ASCUS, which stands for atypical squamous cells of undetermined significance, low grade, high grade, etc. To make our lives as OBGYNs easier, and because there are literally like about 100 different strains of HPV, we break them down into two groups, low risk and high risk. Low-risk types of HPV, nobody really cares about. And what I mean by that is that they don't really cause anything significant other than, let's say, cosmetic things like, oh my gosh, genital warts. High-risk HPV raises my eyebrows and our eyebrows as OBGYNs a little bit more because those are the types that can have an association with cervical cancer. The types that have the highest association with cervical cancer are going to be HPV types 16, 18, and 45. So you can bet your bottom dollar that if you happen to test positive for high-risk type HPV, specifically those three types that I just mentioned, i.e. 16, 18, and 45, you are likely going to be contacted by your OBGYN for further testing, which typically is in the form of something called a colposcopy. HPV is a virus, human papillomavirus. One of the things that I oftentimes tell my patients is don't go home and kill your partner because you don't necessarily know where you got this virus from or where you happen to pick it up. So don't go home accusing anybody of anything unless they happen to be the only person that you've ever slept with in your life. And there aren't a lot of us that can say that. In most people that are young, healthy, not on chronic medications, or with a lot of significant risk factors, things like smoking, being highly sexually promiscuous, or sleeping with someone that is highly sexually promiscuous, most of the time your body is strong enough to get rid of this virus on its own, and status post a procedure like a colposcopy, as long as the findings are not significant, and we'll talk about that on another podcast, most of the time HPV is something that can be managed conservatively, as your body will be strong enough to just get rid of it on its own. Having said that, HPV, if it's high risk, is something that we do follow a little bit more closely, usually in the form of a pap smear every 6 months over the course of the next year, to make sure that there is no progression in the pathology of your pap smear. So there you have it, folks. Just a quick and dirty breakdown on HPV. I hope that this has helped somebody out. Thank you so much for taking time out of what I'm sure is a very busy day to listen to the Ask Dr. Angela podcast. For those of you who would like to have a question, thought, issue featured on the Ask Dr. Angela podcast, please go to my website, www.askdrangela, that's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we do happen to feature your question or suggestion on the podcast, someone from my team will reach out to you and we will send you one of our bomb-ass t-shirts. Thank you again so much for tuning in. In closing, I'd like to leave you with this thought. Never reduce the target. Instead, increase actions. That comes to us from Grant Cardone. Until next time, look better, feel better, be better. I am so looking forward to reconnecting with you on episode 38 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.